Hi everybody, I'm Dr. Joseph Cipriano, and today we have our patient here. Now, obviously with talking to you, I would say the main thing, and I know you're probably going to say the same thing, is going to be the jaw.
Yeah, because it's an all-the-time thing. Okay.
I want you to tell everybody what's been going on with your jaw, like what you've been feeling, how long things have been going on for, things like that.
Well, they started with a lot of dental work, honestly. I had a lot of teeth removed for braces, and then oral surgery that went wrong, and just a whole lot of stuff with my mouth. And here lately, this disc, we did the MRI, not the MRI, but the
CT?
The full scan around the head.
Yep, MRI, could be either MRI or CT,
yeah. And they showed that this is a herniated disc and that I need full open jaw surgery. But as she told me, there's a lady that came and saw you that was in a similar situation and she got relieved, so that's what I'm kind of hoping for, because I don't want to open jaw surgery.
Correct.
But I have issues yawning. I mean, I have issues eating, drinking, and I'm a foodie, so it kind of, it puts a damper on my life.
Now, was this ever an issue before, like, all the dental work? Mm-mm. So something happened.
Something happened.
So
yeah.
Don't know exactly what.
No, but I just want to fix it. Yeah.
Okay. And what side is it that's?
The right. Like, I can see it in the mirror, but.
So now, yes, and I know one of the things, obviously, when we went through and I was feeling that TMJ, those joints there, and when you open your mouth, you can see just how it pulls every time. All right. So that's the main thing. Now, granted, there are other things I know in the knee as well. That's going to be the main thing today. Actually, I'll let you tell everybody everything else, like what else is going on, just so everyone kind of gets an idea.
Like I was telling him, I got the accident when I was 5 years old. I had a bicycle pedal get stuck in my knee. And so even though we handled it probably the best way we could, it causes issues throughout everything, and it goes to my ankle, goes up to my hip, and when you have all this going on, of course you're going to get back pain, and then I got the jaw, so I kind of have things working.
Lower, upper, okay.
Right, and it bogs me down, because like, I'm a nanny, I run around chase kids all day, and love to eat, and
not able to do things.
Right.
All right, we're going to start off. I just want to go through, I want to have you open and close your jaw. I just want to now slowly though, and my wife can get that film, so I want you to slowly open and close. Don't go all the way. I'm feeling it pop going out, but if you guys can probably notice, you see how the jaw is just pulling just like that every time she opens. But now, obviously you feel it. I'm going to imagine, I'll have you do it just one more time, not as wide though.
Okay.
Just slowly open and then close. All right, so do you see how that jaw, I know that's a little painful even.
It's stiff.
It's stiff?
Oh, yeah.
Okay.
And it causes, because it's like crooked, so it's pulling pressure over here.
Okay.
Because I massage this a lot too, just because it feels like it's literally, like you said, it's pulling.
Yeah. Yeah, every time you open, now granted, I'm like exaggerating, saying like that, but it is still pulling in that direction. So yeah, when we go to do the Y strap, I'm going to do a little bit different, like I was telling you before, with the chin strap underneath to help with the pull. After we do that, if the jaw is good, granted that's what we want. If there are still issues, I'll go through and I'll do further assessment and we'll get that moving for you. But first, I'm going to have you stand up. I just want to run through some ranges of motion.
Okay.
I want you to look all the way up at the ceiling for me. Any pain, tenderness, tightness, pulling, anything like that?
It's just tight right at the base of my skull.
Okay. Look all the way down to the ground. Any issues with that?
No.
Okay, good. Bring one ear to one shoulder. Any issues?
It's really tight right here.
Okay. And then to the other side.
It's the same thing.
Same thing? Okay. And then I want you to just rotate over either side.
It's still like around the same spots that are real tight, but I kind of wonder if that's not because I have so many issues with my jaw.
Can definitely do that.
Because that feels all really close.
It is, yeah. Just how the mandible, where it comes up and where it connects on the ligament. That's why I say I like to do that full body adjustment first, and it can realign it even without touching the jaw. But we'll see how, everyone is a little bit different. Let's drop down to the low back. I want you to bend forward at the waist for me. Any pain, tenderness, tightness, pulling?
It pulls right here.
Does the pain stay in that, or does it ever go down?
It goes through my rear.
Okay. So not past the knees or anything like that?
Nope, stops like right here.
Okay. If you extend back like this?
Nope, my back pops out.
I'm hearing that. If you bend down to either side?
Kind of like.
Okay. So it's like up and across, kind of going around? All right, and then if you just rotate, any issues with rotation? No, okay. I am going to have you lay face down for me. And I'll have you bring your hands down here. Good. Okay, so we are going to start. We're going to scan the body, go from that cervical spine all the way down, checking the leg length. And we're going to check that symmetry from the right to the left. So we're going to start with palpating. Let me know if anything is tender to the touch, okay?
Okay.
So we start in that cervical spine. Going into the thoracic. Hearing things move here. Dropping down into the lumbar. Now I was feeling some things. I'll see if I can actually notice it when I glance up the body or not. When I push in over that right side, any pain with that?
It's just a little uncomfortable. It's
Okay.
not painful.
Alright, just uncomfortable, okay. Any issues over the sacrum? Or over that left SI joint?
Yeah.
Okay, so both SI joints having some issues. We're going to come down here, check the leg length. As you can tell, she's pulling short on that right side here. Okay, now when we scan up, this is looking a little bit higher on that right side. Now the one thing that I was noticing when I was palpating in, everything just felt rotated, not much. It's not even much where you can really even notice it, but I can feel it when going down. Everything just seems like it's a little bit over to that left side. So what we're going to do, we're going to do an adjustment for that so we can bring everything back to midline. Let's go ahead, we're going to use the Theragun. We're just going to relax everything. Let me know how this feels. There we go. How was that?
That was great.
Good. Okay. So we're going to start up top at that cervical thoracic junction here.
Okay.
Alright, and we are going to start with that T3 on the left here. There we go. Okay, drop down to T2 on the right. There we go. Okay, I'm going to have you take a deep breath in and exhale out. Good. One more time, deep breath in and out. There we go, good. Let's recheck that leg length. Jeez, that's looking pretty darn good already. Okay, I want you to sit up on the table for me. I want you to straddle the table, so one leg on either side. Okay. First things first, make sure your thighs are squeezing in on the table. And one arm over that shoulder, the other one over here. So this side, I want you to rotate all the way this way and look over the shoulder for me. There we go. Good. And lay face down. Still looking good. Okay, we're going to stabilize on the sacrum. I want you to raise that right leg up for me. Any pain, tenderness, tightness?
No.
Good. Relax that side. Raise the left side for me.
Ooh. Yeah, it hurts.
It's hurting. So you guys see, I know. Relax that leg. That's what happens. So what's happening, actually, always easier to pull up the spine here. All right, I'm going to lay a model spine on your back.
Okay.
Okay. So picture, let's make this anatomically correct here. So picture what's going on. The reason her sacrum, that left leg, doesn't want to raise up as high, or it's harder for her to raise it, is her sacrum is shifting off to the right like this. So the ligaments on this side are loose, allowing her to raise her leg up. Now on this side, everything is taut, tight, and pulling, and restricting her from raising that leg up. So we're going to do drops on the sacrum. They're going to be done P to A, which means from posterior to anterior. And then we're going to do a clockwise torque, so we can bring that sacrum back to midline. I want you to slide down on the table just a little bit. Perfect right there. All right, so the table's going to come up.
I know I've noticed over the years that I walk a little different because my knee giving me issues. And that could be.
That could have been, yeah, what's been causing that even. Okay, so I want you to cross the bad leg over the good leg for me.
Bad leg over the good leg.
Yep. Table's going to come off. It's going to be dropping
Yeah.
like that. Okay.
I've had.
You have drop type techniques? Okay.
Yes, sir.
uncross and bend this knee for me. Good. One more. Good. And down. Raise that left side up again for me. How does that feel?
A lot better.
Good.
My thigh doesn't even hurt holding it up.
Good. Yeah, I know that first time wasn't looking that good, but now, definitely moving better. All right, I'm gonna have you lay on your side and face me this way, please. Yeah, we're gonna bend that top leg. Perfect. Perfect, good. And then flip to the other side. Good. Good. And then flat on your back. Okay, from here we're going to do leg pulls, so I want you to just relax the legs.
Okay.
And you'll feel some release in the ankle, the knee going up. Relax, let me have your leg. Good. Let's see, one more time. Relax, relax. We gotta get you relaxed. There it was. Come on up. I know you felt that after, once we got that to relax a bit. Alright, I'm gonna have you stand up.
Okay.
I'm gonna have you stand right here for me. Okay, bring your arms to your side. Yep, I'm gonna come up and over.
Like this?
Yep, just like that, good. Alright, I want you to squeeze your elbows together. Good, and relax. So we got that moved already, really good. I want you to take a seat right here, facing that way. Okay, bring one arm over, good. Okay, what I want you to do, take a deep breath in, and bring it down, exhale out, breathe all the way out. Good. Okay, slide down just a little bit. I'm gonna have you relax your hands on your stomach. So, we're gonna do the Y strap. This time a little bit different, we're gonna use the jaw strap as well. Because you are very petite, did one of you guys like to come down and just hold down on her knees for me? Either or. So just, doesn't have to be tight, just holding down just a little bit. Just because that you're so light, no matter whatever I pull, you're just gonna slide up.
Right.
So I just need a little bit of resistance. Okay, lift your head up for me. Good.
And what does this additional strap do again? Just like stabilize those, or?
I will show you.
Okay.
So this is going around here, and I'm gonna want you to keep your jaw and your chin shut here. So this, do you feel how it's underneath the jaw? So now when we pull and do that decompression, it's gonna decompress, keeping the jaw locked in and pulled as well.
Okay, awesome.
Cool. Just relax, just like that. How does that feel?
Okay.
Relax, take that off.
A lot of pressure on my shoulders, but it just,
You felt how that?
it's like it doesn't know how to let it go.
Now, was this a little bit different than what you've had?
Oh yeah.
Yeah. Yeah, you feel how that decompresses the spine like that? Good. Alright, let's have you sit up. Good, just relax for a moment. Alright, let me have you just turn and face that way. Just relax everything just a little bit in the back. lightly, slowly, I want you to open the jaw for me. Go back.
Like it's not clicking as much.
Good. You notice a difference?
Yeah. Like it doesn't even feel like
No, I don't want you to
coming up.
stress it all the way.
No,
That's
no,
fine.
no.
Okay.
I can just, it normally comes up over this, like where the cheekbone's at.
Mm-hmm.
And it's not coming up as far. So, that's good. That's great.
Noticing a difference?
Yeah.
Okay, and you see, that's why I told you first off, before we just went in and jumped in and did the jaw adjustment, I wanted to clear the spine out first, because as you can tell, it was up top here
Right.
that was actually contributing to that jaw.
Right.
So,
Awesome.
see, so in your case, I don't actually even have to do any type of jaw adjustment because you're already feeling that relief like that.
That's insane.
Did you think that just a cervical adjustment like that, a decompression would
Well,
do?
no, because I've had it done before.
Not like this? you
Not
had.
like this. No, not like this.
And that's what I mean. That decompression adjustment, as you can tell, it's a very powerful movement. Even as simple as, with jaw issues, you cleared it up that quickly for you.
I don't even have pain in that area right now, and I did in a long time. So that's
Okay.
crazy.
All right, let me have you stand up. Let me just run through some of the other things that we did originally. I want you to look up. I want you to look down. How are things feeling? Because you've been adjusted before. Unlike your boyfriend, I know it was his first time, but for you, how was this experience compared to?
I'm a lot more like relaxed and I'm a lot more opened up than what they could do. And like I said, they had all this fancy equipment and they had all kinds of stuff, and it just showed me that that's not necessary to get this kind of relief.
Just hands, strap. I use a massage device. Granted, there's multiple other massage devices people can use, but when you relax the muscles first, because the muscles, you got to realize the muscles attach to the bone, and if things are taut and tight, it's going to just pull on the bone. So as many adjustments as you want to do, you're going to make an adjustment, and then it's going to go back instantly because the muscles are taut and going to pull it back. So when you relax things first, then make an adjustment. Bless you. Your body, not only do you feel the relief already, but it will hold that adjustment a lot longer,
Right.
which is what you need.
Yeah, I just can't get over this.
Good. And then lower body, have you bent forward at the waist and come up?
It's just a lot more range of motion. Like my knee feels great.
Knee feels good right now?
Yeah, my hip feels good because that's more so what's bothering me is my hip.
Because the knee, the hip, it pulled
Yeah.
everything. Yeah, I mean, you could tell because you've been how you've been guarded ever since that surgery, like you said, in the knee, and you're always walking that one way. It was actually more of a sacral issue than anything. So,
That's crazy.
there you guys go. As you can tell, she came in, literally, the chief complaint was a jaw adjustment.
Right.
Is there a chief complaint of a jaw
No,
issue?
not right now. I'm very interested to see how long this holds.
Good. So that was the main thing. So everyone out there that is watching, the reason I make these videos, so you see people who are experiencing issues, and then let everyone know again, how long have you been having that jaw?
Years. And like I said, it's causing, we all eat, it's causing
Yeah.
a day-to-day issue, so.
Yep.
And it doesn't even bother me to be talking to you right now, and it was when I came in talking to you, so.
Good.
It's insane.
There you guys go. I'm telling you, this is the reason why these videos are made, so you can see other people getting the relief that they didn't realize they could find. So, trust me, any jaw issues, even hip issues, knee, I'm telling you, this works. I don't know how many videos I need to post out there to show people that you don't have to live in pain or discomfort or tightness, and you don't have to do that. So, I literally plaster my name on the wall so people know where to go. drjosephcipriano.com. Send us a message from there, and I'd love to help you out, guys. Have a good one, everybody.